Because this report's been looking at some of the problems that can occur with children born through IVF. And one of those is multiple births. But that's something that's not common in Australia.
Well, I think the first thing to say is that should IVF be the best treatment for unexplained infertility? That's one of the questions that we've grappled with over the years. Interestingly, two of the authors of this current BMJ journal actually wrote the seminal paper showing that simple low-level treatments for unexplained infertility don't work compared to just trying on your own. And so we have a dichotomy. Is it doing nothing, or is it doing the thing that is most likely to work? And we know that IVF significantly increases these couples' chances of conceiving. Now, the problem about multiple birth relates to practices in IVF when too many embryos are replaced in a cycle. But in Australia, we overwhelmingly undertake single embryo transfer. And the twin pregnancy rate across the country is less than 8% from IVF now.
Is IVF still seen? I mean, obviously it was originally invented for people with much narrower range of infertility issues and has now exploded into a much broader market. Is there a sense within the population that it's kind of like not so much even a last resort now, but a kind of like, you know what,
fallback, sort of.
A good fallback, we know it's going to work, we'll just leave it till 38, 39, and then there's IVF if we can't conceive. It's becoming nearly too accessible?
Well, not too accessible, but the message, the preventative health message that we would give to couples and to women is to don't leave it too long. We know that female age is critical, and we know that IVF doesn't necessarily rescue that. We don't make women's eggs any younger. And so the preventative health message is that if you're in the right relationship space, you get on with it. You know, you don't use career and mortgages and all sorts of other reasons to put off what is going to be potentially the most important thing to you through your life. And so that's one issue. And I think the second issue is just because you are older does not mean you don't have any chance of getting pregnant and therefore you need IVF. If a 43-year-old woman came to me, and they do often, you know, a week after their honeymoon and says, well, I'm 43, surely IVF must be better than sex. The answer to that is no, because they could be in that group that are destined to conceive on their own, and then they try on their own. Sure, we might modify the curve for that woman, certainly wouldn't tell her to wait for 2 to 3 years to try to conceive. That would be disastrous. But we should give them an appropriate period of time to try on their own. And this is the sort of educative, consultative process that goes on between fertility specialists and patients all the time.
Fascinating. Mark Bowman, thank you so much for dropping in and chatting to us today. Thank you.